Good day. Good day, everyone. How are you guys? I know that you're doing well right now. So, kumusta po tayong lahat? And for today, we'll be discussing about a very important topic pa rin po pagdating sa ating NCLEX and also our preparations, our PNLE, or even those who are preparing for the exams at the nursing school. So, this one, guys, is for all of you. Okay, for today, we'll be discussing about the concept of your Parkinson's disease. Concept under your neuro, under your medical surgical nursing, or adult health nursing in the case you're preparing for the NCLEX. Okay, so let's start about your Parkinson's disease, a very famous, and sometimes it's a landmark case in your PNLE. Okay, kapatid, kapag sinabi nating Parkinson's disease, it's a chronic and progressive disorder. So, ano ibig sabihin nito? One thing that should be coming off of our mind is that Parkinson's disease is not an acute disease. It does not happen overnight. It's not an acute, it's not even an emergency per se. But later on, as we go along with our symptoms, we can see that sometimes now this will become an emergency. But the disease process as a whole, it's a chronic and a progressive disorder. So take note of the word progressive because yan palagi po ang tinatanong pagdating sa ating boards or even in the major exams that we have in the nursing school. So kapag binasa mo po yung progressive chronic disorder, okay, one thing na dapat papasok agad sa isipan natin, this concept or this question must be asking about Parkinson's disease. Pangalawa, another thing kapatid is that you need to remember that this is an NCLEX and Philippine Nurse Licensure Examination favorite. So what I'm trying to say is that most of our examinations in the NCLEX will be asking about Parkinson's disease, not necessarily about the disease process, but of course about the management, about safety, about critical management, about real case scenarios, hospital-based scenarios. Okay? So again, this is a chronic and progressive disorder. Pangalawa kapatid, dapat na malaman din natin that the major problem that we have in your Parkinson's disease is the decreased dopamine level. So ngayon, ano kapatid, ano ngayon kung bakit mahalaga no nabantayan po natin ang ating dopamine levels. So ang problema natin sa Parkinson's disease bumaba po ang ating dopamine levels. Ano ngayon? We need to remember that your dopamine is the one that is a neurotransmitter that's responsible for the movement of your fine motors. Okay, so ano 'yun? Kapatid, kapag sinabi nating fine motors, ito yung paggalaw ng ating mga kamay. Yun yung mga fine motor movements ng ating katawan, the specific and the finesse movements of our body. Okay? Particularly yung neuromuscular and neuroskeletal. Okay? So, dahil bumaba yung ating dopamine na siyang responsible for fine motor movements, so you need now to think, magkakaroon tayo ng problema sa ating fine motor movements. Ganun lang siya kasimple. Aside from that, meron din tayong isang problema because ang pagbaba ng isang neurotransmitter ay siya namang pagtaas ng isa pa. Okay, what's that? There is an increased acetylcholine levels here. Ngayon, ano naman ang trabaho ng ating acetylcholine? You need to remember that your acetylcholine is the one that's responsible for involuntary motor movements and also your salivation. We need to take note of this. You put down everything here. You write down all of those concepts na ibinababa po natin dito. Okay? So, now, we need to remember as well that Parkinson's disease is more common among males. Okay? So, it's more common among males specifically for ages 50 years old and above. So, when you were asked kung kanino siya mas common, kung kanino siya or sino ang mas at risk, you should be answering males of more than 50 years old. Okay? Now, kapatid, ano naman yung mga assessments na makikita natin? Again, go back to the concept na bumaba po yung ating dopamine dito. So, ano ngayon kung bababa ang ating dopamine? One thing that should be coming off your mind is magkakaroon tayo ng slow movement and we call that bradykinesia. So, kapatid, ang bradykinesia, pwede pa siyang mag-progress, pwede pa grumabi yung ating slow movement. It may lead to what we call as your akinesia. Why? Because in early stages, your bradykinesia will manifest because it's an early sign. But later on, your bradykinesia may progress to akinesia or the absence or the total absence of your movement. And we need to remember that akinesia is already a late sign. Again, we need to think that your Parkinson's disease, it's not abrupt, it's not acute, but it's chronic and progressive. Okay, kapatid, another din na makikita natin is nagkakaroon ng stooped posture ang ating pasyente, which is also very, very common in your Parkinson's disease. Another also is your shuffling gait. Kapatid, kapag sinabi natin shuffling gait, ano ang problema natin dito? Unstable ang gait po ng ating pasyente. Okay? So, now, muscle rigidity will also manifest, which may lead to your stiffness. Kapatid, you need to remember this one. Bakit? So, we need to be thinking that your rigidity and stiffness, okay, will alter the activities of daily living ng iyong pasyente. Okay, so, ano ngayon? Okay, which is, may rigidity tayo, may stiffness tayo. We need to remember that this is greatest in the morning. So now, because it's greatest in the morning, one thing that should be coming off our mind now is that you should be managing it. And later on, isa-isahin po natin. Okay? So another is your dysarthria. So dysarthria means there's difficulty in speaking. Dysphagia, difficulty in swallowing. Again, it's because nagka-problema na po tayo sa ating mga muscles. Okay? Another as well, kapatid, is your drooling of saliva because, again, nagkaroon na tayo ng increased salivation caused by the increase of your acetylcholine levels. Okay? Another also is nagkaroon tayo ng micrographia or the micrographia means napakaliit po ng sulat kami ng ating pasyente. Mask-like face, bakit? Hindi na maigalaw ni pasyente yung kanyang muka. And also, we have this what we call as your tremors, which is very specific and pathognomonic class to your Parkinson's disease. Bakit? Ang klase po ng tremors natin dito is your pill rolling tremors. It's like this. Okay? Para siyang ganyan, nagro-roll ng pill sa kanyang fingers. Okay? This is what we call as your pill rolling tremors or resting tremors. Okay. So, we need to remember that in your muscle rigidity or the stiffness, okay, the management that we should be having because it occurs in the morning, okay, you manage this one by giving your patient a warm bath. Okay? And because all of these things happen specifically in your shuffling gait, naninigas po si pasyente, you need to remember, okay, that priority here is the safety of the patient. And in fact, in your Parkinson's disease, one thing that you should be coming off your mind is that priority is safety. Now, let's talk about the interventions. Ano nga ba yung magagawa natin kapag sa pasyente natin ay meron ng Parkinson's disease? First, kapatid, pag-usapan natin are your medications. What are those medications that we're giving to our patient? Number one, we think of your, ano nga bang naging problema natin? Ang problema natin, bumaba po ang ating dopamine levels. Okay? So, saan siya ginagawa? It is actually produced in your basal ganglia or the base of your brain. So now, kapatid, what we need to do is to increase your dopamine. Okay? To increase your dopamine levels. So, ano nga ba ang group of medicines or medications na ibibigay natin sa pasyente? First, let's think of your dopaminergics. Kapatid, ang mga medicine po or ang mga drugs po na magpapataas po sa ating dopamine levels ay yung tinatawag nating dopaminergics. Okay, you write that down. Kapatid, what is the best example of your dopaminergic here? We think of your levodopa plus carbidopa. Okay, sulat mo. Levodopa plus carbidopa. Brand name po niyan is Cinemet. Kapatid, ano ang trabaho nito? It will increase your dopamine levels in the body. Okay? Particularly in the basal ganglia. Okay, kapatid, hindi siya magiging effective if we will be giving levodopa or plus carbidopa, okay, or brand name Cinemet alone. So, we need to give another drug, which is your entacapone. Now, yung entacapone naman, kapatid, it will increase the effectiveness of your levodopa. So, we need to remember that one. Again, levodopa plus carbidopa, Cinemet, and then we also give our patient entacapone. Okay, so now, we need to consider these things when we are giving your dopaminergics. First one, we need to avoid these very important things here. Okay, we need to avoid MAOIs or monoamine oxidase inhibitors at this time. Avoid tyramine-rich foods. Bakit, kapatid? Itong dalawang to, it will cause your hypertensive crisis. Okay? If this will be taken together with your dopaminergics, we need to remember that one. Okay, also avoid vitamin B6 or pyridoxine. Bakit kapatid? This is an antagonist, okay, to your dopaminergics. So you write that down. Okay, so what are other consideration here? We need to remember that your common side effect of your dopaminergic kapatid or your Cinemet is orthostatic hypotension. And then pwede rin magkaroon ng red-orange color urine. And we need to remember that the change of color in the urine is just but normal. Okay? So, you write that down, kapatid. Okay. So, another intervention sa pwede din nating ibigay. Again, dalawa pa ang problema natin. Ang pagbaba ng ating dopamine. Okay, which is kailangan natin siyang pataasin. Magbibigay po tayo ng dopaminergics in your Cinemet. And then, para mas maging malakas si Cinemet, kailangan po natin ng Intacapone. Kapag here naman, isa pang problema natin ay ang masyadong mataas na acetylcholine. Okay, and we call those cholinergics. So dito, anong ibibigay natin? We give your anticholinergic. Okay, we give your patient again your anticholinergic. So what are those drugs, kapatid? Okay, na anticholinergics. Okay, you think of your K-back. Can you think of your K-back? What are those? Cogentin, aciniton, Benadryl, Artane, Kemadryl. Again, Cogentin, aciniton, Benadryl, Artane, Kemadryl. Kapatid, anong magiging functions nito? So it will act, kapatid, okay, by decreasing your salivation. Okay, so sa mga effect nito is the decrease of salivation and also is the decrease in the involuntary movement of your skeletal muscles. So yan, kapatid. So we need to remember that one. So we need to focus on the salivation because the most important nursing consideration would follow. Kapatid, kapag nasobrahan din tayo sa anticholinergic at hindi natin na-monitor si pasyente, it may lead also to our patient having this dry mouth, which is common side effect. Okay? So, thank you, Tops. Maraming salamat for being with me in the concept of your Parkinson's disease. Antabayan na po natin ang mga susunod na topic dito naman po yan sa ating YouTube channel. Maraming salamat, Tops. Ingat.